So I'm going to talk about constipation in children. It's something that we all see. We all see in the context of avoiding difficulties. We all see in the context of caring for our children. It is wicked common. I receive a modicum of research support for some of the things I do, mostly related to inflammatory bowel disease, which is another area I'm interested in, and I've received some research support from TAP and Astra in the past, but nothing relevant to what we're going to talk about today. What we are going to talk about is constipation in all its glory in kids. We're going to talk about how we think about patients who have constipation or patients that we suspect have constipation and how we work them up. And then we're going to talk about treatment strategies for managing constipation, both routine and difficult patients. So I'm hoping that you listen, take some notes, and then hopefully when we have our discussion period afterwards, feel free to ask questions, because I think that's where the best ground is covered, because this is an in-the-trenches sort of talk, because constipation is something that we always deal with all the time. So it is common. It is the single most common thing that I see in my practice. About 25% of my business is related to constipation. So common, so problematic, yet at the same time, it is almost impossible to define it. What is constipation? We use the term all the time, but what is it? And there is no consensus. There are those who will define it in terms of frequency. And here you can see a chart listing how frequently patients can have bowel movements from birth to toddlerhood. And you can see that kids can have anywhere from 5 up to 15 bowel movements per week, or if you look at per day means, anywhere from 1, 2, 3 bowel movements a day. No clear range beyond which kids may be constipated. Some kids have a bowel movement every 2 or 3 days. Some kids have 2 bowel movements a day. There's really no concise way of using frequency as a metric. You can look at consistency, and I know that Dr. Estrada has shown you the esteemed Bristol scale developed by the Brits for us, who decided to take a systematic approach to constipation and come up with all these different varieties of stool, from more formed to less formed. And these are useful to have if you're a pediatrician. Certainly if you're a gastroenterologist, laminate a card or buy a laminated card. It's one of the few areas about stool management that the kids actually like to participate in. They get a big kick. They always giggle at first, but then they'll actually look pretty carefully at it, and they'll point to which their stool is most like. And you don't need to look at the verbiage. They can look at the stool pictures themselves. And that works pretty well. Consistency, though, also fails us in the diagnosis of constipation, because people can have very loose stools and no symptoms, and people can have very hard stools and no symptoms. So in terms of pathology and what happens in the office, consistency fails us. Functional is what I describe. I just take a very pragmatic, outcome-oriented approach. I define constipation as clinical symptoms with some relation to defecation, and most importantly, the symptoms improve with treatment directed towards the passage of softer and more regular bowel movements. That is my approach, because that is really what brought people to the office in the first place. They came because the kids had belly pain. Maybe they knew they had constipation, maybe they didn't, as Dr. Estrada said. But they have pain, we make a diagnosis, we treat them for what we find, and they get better. And therein lies the rub. I think it really is a functional constipation, because it's what brought them to see us in the first place. So that's how I like to think about it. It's not necessarily how frequent or how formed it is, although they are predictors. Obviously, kids who have less frequent or harder bowel movements may be closer to the edge in terms of symptoms, but really you're looking for who's having difficulties.